Have you ever wondered about the critical risk on blood pressure and if it has any correlation to cardiovascular risk? Hello, my name is Valerie Gonzalez, and I would like you to tag along on my presentation. On this PowerPoint, you will see a timeline of what I did this fall semester. Cardiovascular disease is in women who deliver preterm births. Can blood pressure lowering treatment prevent cardiovascular disease? And treatment to lower blood pressure. During the first month, we looked for articles 1 to 3 and wrote short summaries for them. We then looked for articles 4 to 6 and also wrote short summaries for them. We then worked on a final paper which was revised before it was able to be submitted. On this PowerPoint, we have short summaries from these articles that we have been talking about. We will talk about the hypertonic and hypotonic blood pressure and if it has any correlation to having any cardiovascular disease. Critical risk on people with high blood pressure. (23,374) patients who had high blood pressure were transferred for an evaluation and management of a non-ST segment evaluation myocardial infarction. The variables were age, sex, heart rate, weight, smoking, and hemoglobin levels. The patients were divided into 5 subgroups based on the systolic blood pressure that was taken during admission. Cardiovascular disease in women who delivered preterm births. The people who were involved in this observation were either pregnant women or women who had delivered preterm births. Every 2 to 5 years, the births were recorded and as well as the exams. 272 women experienced preterm and 777 reported all-term births. Women with a higher blood pressure during pregnancy may have affected the fact that they delivered a preterm birth. Is there a higher risk of cardiovascular disease and systolic blood pressure? The blood pressure of the participants were measured during the first 2 years. After 11.3 years, a follow-up was conducted where 162 patients had a cardiovascular event, and 95 patients died from a cardiovascular disease. Other factors that contributed were diabetes and problems of the heart, who were at a higher risk for high blood pressure and a higher chance for passing away. Dairy intake and the effects of blood pressure. The study done by Marka Rankar-Borcher was to determine whether or not dairy intake had an effect on an individual's high blood pressure. After the consumption of low-fat milk and regular fat cheese, they observed why aminobutyric acid played a role on ambulatory blood pressure. The results showed that the patients had no effects short-term. Can blood pressure lowering treatment prevent cardiovascular disease? People who took the survey were from ages of 30 to 74 years old. The blood pressure was taken in a mobile examination center with 95.5% had 3 blood pressure measurements, 2.3% had 2 blood pressure measurements, and 2.2% had 1 blood pressure measurement. The results showed that 9,931 of the patients were at target, 2,118 of them were above target, and that 914 of them were reclassified. 44.8% of the reclassified adults of ages 60 to 74 had more than 20% absolute cardiovascular risk, which equals to 0.8 million adults. Treatment to lower blood pressure. This study was conducted in the Caribbean islands where they monitored individuals with hypertension and cardiovascular disease. Participants were in ambulatory blood pressure monitoring for 24 hours. An actigraph was worn for 3 days and 2 nights with the first 24 hours overlapping with the ABPM. During the spring semester, I will be using the proper equipment to learn how to take blood pressure measurements, and I will by choosing the people around me, and I will be graphing and using charts to determine whether our community has a higher chance of having cardiovascular risk. The articles mentioned was to find out whether abnormal blood pressures contributed to cardiovascular diseases. Some of the patients were given medication and saved from cardiovascular events, and high hypertonic blood pressure during pregnancy can influence cardiovascular risk. Some of the references I use are as follows. I would like to thank Dr. Ramon C. de la Torre, Sabrina Rios, my research student mentor from Laredo College, Dr. Nora Garza, VP for Resource Development and Title V Project Director, Mrs. Aguero Riojas, LEAPS Project Director, Mrs. Gabriela Solis Cavazos, Undergraduate Research Coordinator, for giving me this opportunity of working with them in the LEAPS program.